Hello and welcome to vlog number 111. This week I'm going to talk about tremor in Parkinson's disease. Although it is not the only symptom by a long way, most people think of the tremor when they think about Parkinson's disease. Indeed, between 70 and 80% of people with Parkinson's have a tremor. A tremor is an involuntary shaking or trembling movement. It can be very annoying, but is not usually the most debilitating symptom of PD. My own tremor, however, became so severe that I considered it to be extremely debilitating. Prior to my DBS, deep brain stimulation operation, my tremor was so severe that I was having trouble feeding myself, and this was far and away the worst symptom to me. It attracted attention from others, so I used to keep my hands jammed in my pockets, or if sitting down, I would sit on my hands. DBS has my tremor mostly under control these days, but stress or tiredness or just being a little under the weather can cause my tremor to emerge once more. Some people with Parkinson's experience a feeling of internal tremor, which is not necessarily visible, and this is something that I get from time to time. Uncomfortable, but not debilitating. The most common Parkinson's tremor is known as a pill rolling tremor, and this refers to tremor in the thumb and fingers that looks like the person is rolling a pill between them, but shaking tremors can also occur. My neurologist told me that tremor is caused by misfiring neurons in the brain, and that DBS works by blocking the signals from these misbehaving neurons. Although other healthcare professionals have told me that they don't actually understand how it works, they just know that it does. I found the following statement about the causes of tremor on www.verywellhealth.com. Tremors are believed to be caused by complex interactions between a number of factors. Alterations in the activity of several areas of the brain, including the substantia nigra, the basal ganglia and the thalamus, as well as changes in the level and action of the neurotransmitter dopamine, are all related to each other and to the production of the tremors. Parkinson's tremor is a resting tremor, so it evidences itself when the body is at rest and stops when intentional movement occurs. It can affect almost any part of the body, but is most common in the fingers and hands, legs and feet, and the jaw. It usually starts on one side of the body and may then progress to both sides, although many patients only ever have tremor on one side. I was told by the neurologist who referred me for DBS that people with tremor-dominant PD tend to have a more benign course, slower progression and less likelihood of developing Parkinson's dementia. And I found evidence of this in my online research, although I have to say that I think that my PD is progressing quite rapidly at the moment, and my Parkinson's is extremely tremor-dominant. So, what can be done to treat Parkinson's tremor? Traditional Parkinson's medications are used to treat tremor, although it has to be said that it's a symptom that can be difficult to treat. I was prescribed carbidopa-levodopa, 2 different dopamine agonists, beta blockers, and an anticholinergic, none of which had the slightest impact on my tremor. Benserazide-levodopa did have a positive effect, but the side effects were so unpleasant that I had to discontinue it. I found that cannabis was very effective in calming my tremor, without any of the unpleasant side effects of the pharmaceuticals. So that was the medication that I used prior to having DBS, and still use now to calm any tremor that DBS doesn't catch. If medication fails to moderate your tremor, then interventions such as DBS or focused ultrasound may be suggested. DBS is the most effective treatment for PD tremor when medication fails, successful in around 90% of cases, although only around 10% of Parkinson's patients are considered suitable for this operation. As one of the 10% and one of the successful 90%, I can vouch for this life-changing surgery. Focused ultrasound is a relatively new treatment which may still be regarded as experimental. For more information, see vlog number 74. Thanks for watching. If you have any questions or have a topic that you'd like me to cover in future vlogs, just leave me a message in the comments and I'll do my best to respond. Have a great week. See you next Friday.